We can send a wish list immediately. Then let's see with Dr. Leanne. Dr. Leanne, who is a clinical neuropsychologist, very few, in UAE, but I think that I feel lucky, that you are having you, and I don't know if you feel lucky, to be within this team and to have this patient before and after, and to see the improvement.
Please, yes, Dr. No, I'm very lucky to be a part of a great team, and they often send me great patients to meet and work with, so no, I'm in a very privileged position. So you're right, there's not many of us anywhere, let alone in UAE. And we're a part of the journey, but we're part of the MDT and quite an important part. We have a very unique skill set in that we understand the neuroanatomy, we have the expertise to do the cognitive, neurocognitive assessments, but we're also experts at behavioral observation and communication, which means that when I meet the patients, there's several things that I'm doing with them to ensure that they're good candidates for DBS. We want the surgery to be successful, so we do need to make sure that we are selecting the right candidates for the surgery. So the first part is the neurocognition. It's primarily known as a movement disorder, but there are other non-movement symptoms associated to Parkinson's disease, including cognitive changes and neurobehavioral changes. So in my assessment, I'm checking to see that if they do have some cognitive changes, which is common, that they're typical for Parkinson's disease and wouldn't necessarily present a problem. But I'm also looking out for red flags that maybe there's perhaps a more advanced dementia going on, which wouldn't make them suitable necessarily for the surgery. So that's very important to have that data and to have that sensitivity to be able to detect patients who may not benefit. Also, there are neurobehavioral elements, so we're looking at mood, we're looking at apathy, we're looking for things like impulse control disorder that may impact their outcome as well. And sometimes that's to do with the medication, sometimes it's to do with the disease process, sometimes it's to do with the reaction to their circumstances. And so we can help to try and tease some of that out and make suggestions about what we should try and control before they go to surgery, how we might need to follow them up to ensure their safety after surgery and to monitor them. But we're also very important in managing expectations. And talking through the patients what they understand about the surgery, have they understood it, what are their goals for the surgery, and are their expectations in line with what's achievable from the surgery. And also to make sure that they have good social support around them. It's not just about the surgery, as Dr. Shivam and Dr. Tamay have mentioned. There's the programming afterwards. There's a lot of aftercare, and sometimes we need to make sure that the individual has the social support around them to be able to follow through and comply with that aftercare for the best outcomes.
Thank you so much. Thank you.
Thank you so much, Dr. Fatima, for that illuminating panel discussion with your wonderful speakers. We were so pleased to hear from everybody there. Thank you so much.